Well, good morning, Miramar, and welcome to the show. I'm your host, Tamara G. As always, you can check us out on all of our social media. We are on Facebook, Twitter, and Instagram at City of Miramar. And with us today is Dr. Kendra Outler. She's better known as Dr. K nationwide. She is a board certified anesthesiologist and public health expert who founded Uzima Health and Wellness after years of bearing witness to and experiencing the health disparities faced by Black patients in major medical centers across the nation. We're going to be talking with Dr. K today about some of those disparities, how this big, beautiful bill may be affecting people of color in particular, and also maternal health. So we've got a lot to get
Well,
forward to and talking with her about. So welcome to the show, Dr. K.
thank you so much, Tamara G. It's always good to be with you. It's always good to be with you. Look, and I can't keep secrets from you. I was in the midst of painting, okay? Talk about multitasking. Being a
Absolutely.
doctor, I got, but painting is one of those things I'm still working on. So, we as women have to do a lot of multitasking. So, number one, always good to see you.
You too, you too. And okay, so I just to let you know, I like that green color.
Oh,
The
you like
green.
the green color?
Yeah, I
Okay,
like the
good.
green
That's the
color.
vote for the green. Okay, good
Yeah,
deal.
one for the green.
Energy. That's what they told me to do. So,
See?
in the midst of working, like I said, you got to do some home care. You got to do all of that as many people are juggling life now.
Right.
So,
The
but
work never ends. The
it
work
never
never ends.
ends. But it is always good to see you and be on a panel with you and to have you host. And, girlfriend, it's been a minute, but I love seeing you.
Same here, Dr. K, same here. So we're going to get started to talk about what is happening,
Mhm.
particularly in our country right now when it comes to healthcare and when it comes to healthcare of Black folks. We know that you produced a newsletter about health disparity topics, and there is an ongoing conversation about the fact that that bill being debated right now is going to affect women, is going to affect people of color, is going to affect poor people. This is pretty alarming.
It is. It's very alarming, and it's a lot of things still in the air about what will actually happen if the bill passes. However, what we do know is that even right now, with this uncertainty, hospitals, safety net hospitals, are bracing themselves. They're looking, anticipating, kind of like the trade war, that there is going to be a shortfall of dollars for healthcare services. Okay. And so if the bill passes, what has been very clear, what a lot of our Congress people, whether they're Republicans or Democrats, universally what they're saying is this will hurt the healthcare industry. This is going to be devastating for over 11 million people who receive healthcare in the United States as it is now. They will be knocked off of the Medicaid coverage or would lack the inability to purchase health care, which we fought for through Obamacare or ACA. That literally is putting us back, almost into the mid 80s, 70s, when people lacked health care. And this is alarming for rural hospitals, and it's alarming for safety net hospitals and urban centers that take care of large majority of Black patients. But we also recognize that rural Americans, whether they be rural white patients or rural Hispanic patients, the fact is this is going to hurt all people in America in terms of their access to health care.
So it does it mean that the money just won't be there for because I know a lot of people go into they treat the emergency room, and I know you've seen this as an anesthesiologist. They treat the emergency room as a primary care physician. So does that mean that if this bill does pass, people won't be able to just go in and get health care anymore and that it will be taken care of no matter what their issue may be?
So I trained as a primary care family medicine doctor from University of Texas Medical Branch, and then when it became a specialty. So I've seen both sides.
Okay.
When I was in medical school, and even when I was getting my public health degree, my work was in HIV, AIDS, and tuberculosis research. And at that time, there was a conversation about the revolving door, okay, where
Yeah.
patients would just come into the emergency room, spin around and come out, and then I could any follow up and come back in. So we really worked hard as a nation to stop that. Hence, we've had access clinics in the community. That was a big movement.
Urgent care centers and
Urgent
your,
care
yeah,
centers,
yeah,
yes. So we used to have these big safety net hospitals. Jackson Memorial is in
yep.
Miami.
Miami, yep.
We have Grady
Broward Health,
Hospital.
yeah.
We had, Charity Hospital in New Orleans. So most cities are anchored by these big public health centers. I'm in Chicago now. We are at Cook County Hospital. We are a safety net hospital, okay? But, we worked hard to make sure giving communities access. And so to answer your question, yeah, the money's going to be gone, okay? There is no money for certain services, or we're going to have to scale back certain services so that we can keep essential services going. And what does that mean? That means that patients will be coming to the emergency room, kind of like the revolving door scenario. And I want to clarify something. It's not that patients want to use the emergency room as a primary care facility, or they just won't go. I talked to patients and they would say, I can't get through, or I can't get an appointment. And I have experienced that. I cannot get an appointment. And then I started to realize you almost have no choice,
Mhm.
right? And so this will squeeze physicians, gynecological doctors, I mean, even your urologist and your heart doctors. They will have a certain number of patients that they can see, a panel, if you will, and they will have to make a choice about which patient is a priority. So there's a business model that we're going to be forced to operate in that will be cruel to some patients. Mm-hmm.
And I know that some people already know that. As you mentioned, you may have a cold or something and you try to get into your PCP, they can't see you for 2 weeks. You'll
Mm-hmm.
be over the cold by then.
Mm-hmm.
And I just made an appointment for a mammogram. They can't
Yes.
see me until July 28th.
Yes.
It's not even July yet.
Mm-hmm.
They can't see me till a
Right.
month into almost the end of the month. So
Mm-hmm.
that's kind of where these services, and that's already now. So I can
Right.
imagine how it's going to be once money dries up and people won't be able to go. But we're worried about all of the people that don't have. I'm worried as well about women because
Mm-hmm.
a lot of times we don't have, and we're
Right.
also women, and it seems like a lot of our issues kind of get pushed to the side for whatever reason. And so, what kind of health coverage is going to be in jeopardy if
Mm-hmm.
this bill passes?
Well, you said something very critical. You said that my appointment won't be until July 28th.
Mhm.
And you are a working woman. Okay. So
With
you
insurance.
right with insurance, but you are a working woman.
Mhm.
And so could you imagine a woman who's out here working and gets busy and then she misses her mammogram?
Mhm.
And then she can't get another one for another 2-3 months. Okay. And we've worked really hard to make sure that preventive care services are accessible, readily accessible. Mammogram mobile units.
Mhm.
So when you ask what things can be defunded due to this bill, even due to the current landscape, that's what we're talking about, Tamara. We're talking about these interventions, preventive interventions that we know work, making sure there's no delay in care, making sure that patients don't have to rejuggle their life, reconfigure their life to get a doctor's appointment. So these are the things when we think about women, we think sometimes more about just the pregnant state. I think that's, most of the lawmakers are men and they're talking and they're speaking and, from that side of their brain, I guess. But the reality is that women have preventive care services as teenagers, little girls, teenagers, as we go through our lifespan, we will see and encounter the doctors earlier
Yes.
and we will have more services that are needed. Okay. And so these are the things that we need to think about come into jeopardy when we say, oh, just defund Medicaid, because a woman will only need it if she is needing, for instance, a termination of pregnancy. That there are reasons little girls, we worked hard for the HPV vaccination, for instance, for little girls to prevent cervical cancer. For young women, we worked hard to make sure they have access to cervical cancer screenings,
Pap smears, things
pap
like
smears.
that.
Yes, we've worked hard to make sure that women have access to that. That's a preventive services that, again, delay until you have symptoms, and now this is an issue. We've worked hard to, again, like we said, mammogram. And when a woman at a certain age presents with things that say, I have chest pain, women as young as 20 years old can be diagnosed with high blood pressure if it's a strong family history. If there is some other issue within her body that makes her prone to hypertensive disease. Polycystic ovarian disease can happen in young women that predisposes them to things like diabetes and hypertension. So therefore, they're going to be seeing the doctor more. So this is critical for the health of women. We call this the preconception health, but let's just call it primary care health of women is now in jeopardy.
Wow. We are speaking today with Dr. Kendra Outler. She is the founder and CEO of Uzima Health and Wellness. She is based out of Chicago, anesthesiologist now, medical doctor, obviously, but did family practice and now anesthesiologist. And we're talking about the things that will possibly be cut in in the big beautiful bill that is supposed to be passed and how it's going to affect people. I want to talk a little bit about Uzima though, because this is something that you started because of a passion that you have. Tell us a little bit about it and where does it come from?
It comes from a space of being a public health activist first. I trained at Emory, Rollins School of Public Health. And, you know, we all have emerged from this pandemic thinking about what can we do for our community and to be a community servant. That's the space that I come from. And so during that time, again, there was funding available to get the message out about healthcare and health disparities that were related to the pandemic. But I thought futuristically, there needs to be an information panel. There needs to be a portal, if you will, that patients can feel that they have a trusted voice to find out what the issues are. And so I've been dedicated to continuing this conversation without the sound bites, but really digging deep and finding sources that people can gather around. I don't say that I have the answers. What I say, these are the issues. And so we vigorously produce a newsletter that goes out every month. This month was about gun violence and the fact that these Medicaid cuts will hurt gun violence victims. Who are victims of gun violence overwhelmingly? Young Black men, age 14 to maybe the early 30s or maybe even 40s. They are the number one cause of death and victims of death and even injuries. Guess what? Who has to take care of them? Usually it's the women and their families. This is devastating for families. Where do these, whether they live or not live, the point is that you have to pay a hospital bill. These
Or they
are,
may need care afterwards. They
or
may
they
need
may need care.
long-term care.
But the guaranteed is that when someone is shot and they come into the trauma room, a trauma bay, there is care that's going to be given. And for a family not to be able to afford that care, or a hospital, let's say the hospital is not able to subsidize that care in some way from federal dollars, is a tragedy, because what it happens is that it limits all of the services ultimately that the hospital will be able to provide to the community, particularly for, again, safety net hospitals that see a lot of trauma. Trauma can not just be gunshot injuries, but they can also be car accidents. So my space on Uzima Health and Wellness, myuzima.org, we continue to discuss the current landscape of public health past COVID, and we want to continue to give patients and the community just the facts, as I call them, via the newsletter.
And I want to mention that too, Dr. K, about COVID, because that's obviously when you and I met
Yeah.
and became friends. But, you know, that was a health disparity too, because some people couldn't, at one time, couldn't get the vaccine,
Right.
or we didn't want to take the vaccine because as Black people, we felt like
Yeah.
maybe it was, you know, some type of experiment on, I mean, it's so much we have to deal with, or that you have to deal with as a doctor to determine, you know, and tell your patients what is myth, what is fact. And
Mm-hmm.
so, do you think that inherently, as people of color, that there is some distrust of the medical system and that they don't want to take care of us?
Yes, that is historically a yes. And that is why having trusted voices, having physicians And someone said, well, why are you, you're not all over your thing as this kind of a white coat stethoscope image. And I said, because I'm part of the community. I never see myself as separated from my community. And so what we have to remember is historically there is mistrust. Historically, and we've worked hard as a medical community to break down those barriers, to not have a separate and unequal healthcare system. But my fear is that this is the landscape, that this current landscape is creating another separate and unequal healthcare system of the haves and the have-nots. And that's very frightening because nationwide, we have people in communities in Nebraska, down to Florida, from California, where they are about recovering from the fires,
Mhm.
to New York. We see communities saying, I'm in fear of not having access to care if this bill passes.
Wow. So not only are you having to deal with Mother Nature issues, like you said, the flooding, and there are people who are still, we're having tornadoes and storms
Yes.
and everything now, hurricanes. People are not being able to get to the doctor or fearing that they may
Mm-hmm.
not can get there. And now you have on top of it, oh, and now I can't pay for it.
That's right.
Do you think that people will just not go? I mean, they'll just give up and die, or is that the only thing they can do? Because if there's nobody there to help you,
Yes.
or if you can't afford the help, what are you going to do?
Well, I want to remember that it's not just the doctors that patients have to get to. Patients have to be able to afford medications. That is something that we have not discussed in the media at large. There have already been changes to the affordability of certain medications. There are fights now to keep certain medications like albuterol, which affects large Black communities, urban centers with large Black and Hispanic communities, the keeping that affordable.
That's for
That's
asthma, right? I believe.
asthma. I'm sorry,
Okay.
asthma. So,
Okay.
I mean, and hypertensive medications. So you went to the doctor, or even say you ended up in the emergency room and they gave you a prescription, but you never filled the prescription. That's what also created the result revolving door in the 70s and the 80s, is that patients said, I cannot afford, I never got the prescription filled. So there are things that, we are able to test. If I tell you to come back for a chest x-ray because you're cold, now doesn't seem to get better. Now you have a community acquired pneumonia and you just say, okay, I'm just going to tough it out because I cannot afford the antibiotics, which was once upon a time covered through either my ACA acquired insurance or
Mhm.
through my Medicaid coverage. These are real scenarios for families. And I think that patients, that most of the messages, the hospital might be closing or can't get to the doctor, but what if you cannot afford your medications? Big
Wow.
deal.
It really is a big deal. And when you put it that simply, Dr. K, I never even thought about that. You're right. I'm thinking about hospitals closing, or maybe people can't get to to see a doctor. But
Mm-hmm.
once you see a doctor and he gives you medicine that costs $700, and the Medicaid doesn't, or you don't have any way to
That's
pay
right.
for that, then you might as well not have gone to the doctor because
You
you
might as
paid.
well not gone. And so
Right.
that when we think about people will die, this is what we're talking about. We're talking about the fact that patients will not be able to get the wraparound services. We're not even going to, we need a whole nother show to talk about mental health and the medications that are needed for some patients. Some patients need 2 and 3 medications when it comes to their mental health stability. So that's almost like a whole nother show, but that's a big deal because a lot of coverage for mental health and the gains that we've made in terms of helping patients uh, are under a threat. Mm-hmm.
Wow. If you're just tuning in, thank you so much for watching Good Morning Miramar. I'm Tamara G, and we are here with Dr. K, Dr. Kendra Outler. She's a board certified anesthesiologist and public health expert who founded Uzima Health and Wellness after years of bearing witness to and experiencing the health disparities faced by Black patients in major medical centers. And Dr. K, I know you were talking about, the different medicines that may be cut for people that have asthma. Of
Mm-hmm.
course, you mentioned heart and healthy uh, drugs that way too. But they also don't really want people to take the obesity drugs. But if you take the obesity drugs, won't that help you with all of the rest of? the problems that you may have?
Oh, yes, I mean that is something that we've again worked hard to find a solution to help patients who are battling obesity. For me, in anesthesia, your ability to come to surgery fit to a certain level, creates a better scenario for your outcome. So this is a big deal. This is a really big deal in terms of access to certain medications. And yes, it is covered for certain patients that meet criteria for hypertension, obesity, sleep apnea, and yes, we'll be losing access to this medication, which again, we want to be able to provide patients with more advanced medications, more advanced studies, so that they can live longer.
Right. And I know that you yourself very involved in healthcare, dental healthcare. I know that's one of your passions because you say it starts when children are small when it
Mm-hmm.
comes to dealing with their health because healthy teeth, healthy mouth makes you healthy throughout your life.
Well, as part of an anesthesiologist, my day starts with open up your mouth. And so someone said, you don't see, you're not a dental expert. I said, I'm an expert in dental disease. When I see it in terms of gingivitis, bleeding gums, one of the things that we see that for trauma patients, for young Black men who, for instance, have gotten recovered from a trauma incident, they may have to go to the ICU, and we can't find a source for an infection. We can't find a source. Guess where it is? It's in the molars. It's in the mouth, and that has been deadly. It's been deadly for children, particularly Black children and Latino children who have lacked access to dental health care, because we do have dental deserts, just like we have maternity deserts, because dental services for children is covered by Medicaid, right? And so this is also a service that is threatening to be eliminated, or a dentist will have to decide which child they're going to prioritize. And what we know is that children battle dental disease. It is a source of pain. It's a source for depression. And long term, it's a source ultimately that puts them at risk for heart disease and any other, and also for women as well. Mm-hmm.
Right. I was gonna say, and again, the ramifications that, when they don't smile, their self-esteem is low.
Yes.
People bully other kids, bully
Right.
adults who don't
Right.
have,
Mm-hmm.
nice teeth. So can you imagine as a child if something is happening with your mouth and there's nothing you can do about it? You're a kid. You can't
Right.
go to the dentist without your parents or without the money to be able to do so. So, I mean, there are quite a few issues. I would
Mm-hmm.
love to know what prompted you to become a doctor because we don't see a lot of Black females, more so obviously now in this day and age than in the past. But what was it that prompted you uh, to do this career? Because you've got to have empathy, you've got to be smart, and you've got to I guess put your feelings aside sometimes when you see things that are happening that you can't control.
Well, what prompted me was I was in a rural background, and we would have to drive for an hour and a half for care. And things that happen in your life as a child. I got a rash. It's a common childhood rash, porteritis rosea, and nobody knew in the little town. And my dad would have to. He took me to three little small doctors and three small town doctors, and then had to take me up to the major medical center. And we were in Georgia at the time, and he swore they so it saved my life. And so he certainly saved me from more home remedies that my grandmother was putting on my body that made me illuminate into some type of a purplish, weepy rash all over. And so I think that experience of having people not know what was wrong with me, and the panic that my family felt, was I going to die? I mean, literally, there was a panic because we're from humble beginnings, a very rural community where there is no doctor. I mean, we drove 30 minutes for the nearest a grocery store. So that always stuck with me. And then as I went to Houston and finished in the high school for health professions, I just knew that that's what I wanted to do. That I wanted to be in the health professions, and I didn't know exactly which, did I have the stamina, did I have the wherewithal for medical school. And that comes in from, for any young person that's deciding that they want to go into medicine, that comes with your mentorship, that comes with your connectivity to communities. And I was blessed in Houston to to be around a lot of Black physicians, physicians that look like me. And we do know that your chances of becoming a physician or even becoming a professional, hell, just entering the workforce means that you have been connected to someone who said to you, you can do this, you can
Absolutely.
be that. And mentorship is very important. And so that's something I still do because I know that that can impact a young person's decision. I want them to be a doctor, but I also want them to contribute to the health, vitality, and wellness of their community.
And what can people do? We've been talking about what is possibly going to happen with this big, beautiful bill. What can people do to, hit this head on? Should they call their legislators? Should they, I know a lot of people are demonstrating. What should they do?
What they should do is go to their state's website. They need to Google, for instance, you're in Florida, I'm in Illinois. Uh, Google the reconciliation bill, the big beautiful bill, and potential cuts for the state of where blank. Is
Okay.
it Georgia, Illinois? You need to read this line by line. I think that if you are in certain communities where maybe people do not have access to the communities, organize meetings, okay? Facebook meetings. We're all using our phones now. Get on the phone with other people and say, did you read this? You need to be informed. There are decisions like the one that was recently done with the Supreme Court that said, if you listen to the media about the Planned Parenthood and loss of coverage, well, we don't need that. Women and men can get services from Planned Parenthood. They
Absolutely.
majority see women, but they also see, as we started off at the top of the hour, talking about preventive care services. The fact that this organization, this means of healthcare providers, this cannot provide preventive care services because it provides a service that is controversial to many, is it will deny care to women, and that care is high blood pressure medications, mammography, which we talked about at the top of this conversation. We cannot afford in this current landscape to lose any providers that take care of urban families, particularly Black women, that lack access because of their inability to get to hospitals or doctor's appointments because they have to work. People have to work. So read through that. Don't just go with the buzzwords and say, "Oh, that's a bad facility, so we shouldn't fund it anyway." We have to advocate for all people to get good health care and have access because that person at one point might be you.
Thank you so much. That's a great way to end it. Dr. K, thank you so much. Dr. Kendra Outler, board certified anesthesiologist and public health expert, also the founder and CEO of Uzima Health and Wellness. Thank you so much. You're right. We could be talking forever because of all the things that are happening in the United States now when it comes to healthcare. But thank you so much for at least telling us, the things that are possible that we're going to possibly lose if this bill passes when it comes to Medicaid, Medicare, women's services, medicine, everything. So, as she said, go and read what is going to happen to our state. We're in Florida in the reconciliation bill. Go online and Google it and see what we're going to lose if it passes. Because, as she said, Dr. K said, one day it could be you. Thank you so much for joining us today on Good Morning Miramar. Thank you, Dr. K. I look forward to seeing
Thank
you soon,
you.
sis.
You will. You will. See, I need a vacation, Tamara
Hey,
G.
come on down. Come on
The
down to
work never
Florida.
stops. The work never stops. So thank you very much for this opportunity. I hope that we can continue this conversation.
Absolutely.
Tonight should be very interesting to see where this bill goes. Again, everybody secure your information about your healthcare services in your area and share.
All right. And thank you for watching Good Morning Miramar. Until next time, I'm your host, Tamara G. See ya.